Assalamualaikum warahmatullahi wabarakatuh. In here I will present about English for nursing. Before I presentation, I will introduce my name. My name is Solikhatul Khasanah. Okay, and let's uh, discuss about English for nursing. Okay, and the first is table of context. There are five topic, and the first is course goals, and number two course objective, and number three learning method, number four specification, and last about the material. Okay, the first is course goals. The aim of this course is to improve the English language skills of students majoring in nursing or nursing, with a special focus on reading, writing, and communication skills. By the end of the course, students will have developed the competencies necessary to write, speak, and read effectively in English in nursing specific context. And the next about course objective or about learning objective. For there are four learning objectives. The first is student can identify health document of prescription drug medical device in English, and then student can identify English vocabulary and grammar in nursing. And the next, compose clear and concise report patient document related to patient or hospital data. And the last, communicate in a nursing specific context using correct and appropriate pronunciation, intonation, grammar, and vocabulary. And the next, about learning method. There are three learning methods. The first is project-based learning, and the next, number two, role play, and the last is practice. In project-based learning, students are given a problem or project related to health, and they must analyze the problem either in group or individually. And in role play, students practice in pair as a nurse receiving a patient. And in practice, student pair practice as a nurse and patient, and nurse and a patient. And the next is specification. In specification, there are time and the student requirement. In the time or duration, there is 3 hours in 45 minutes, and in 16 meeting in 2 months. And then the student requirement, minimum 17 years old, nursing student and nurses. And the last, about the materials. The first is greeting. There are three topics. The first is greeting someone with various expression, and then responses, and the last, goodbye. In time is 2 hours. And the next is introduction. In introduction, there are two topics. The first is introducing oneself, and the last, introducing other. In introduction, the time is 2 hours in meeting. And the next is patient document and health document. There are four topics, and like understand health document, medicine prescription and medical device, and then interpret textbook or relation on health in English, and then write patient document, and the last, read health document. In patient document and health document, the time is 6 hours. And then administration. In administration, there are to topic like write patient document, medication names, and then write and read emails, letter, or other written correspondence for health related purpose. And in administration, the time is uh, in 8 hours. And the last is communication. In communication, there are two topics like communication effectively in nursing specific context and scenarios using correct pronunciation and intonation. And the last, listen to conversation during classroom learning. And in communication, there time 6 hours. And I think clear enough. And thank you for your attention. Uh, I apologize if I mistake. Thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.